Hello, I'm Dr. Nasrullah. Today, Lasik is the most popular form of refractive surgery for reducing dependence on glasses or contacts. In this video, you'll see several real-life patients talking about their positive experiences with Lasik. The people who are happiest with Lasik are the ones who take the time to understand their own visual needs and what Lasik can and cannot do for them. The purpose of this video is to help you develop informed and realistic expectations. If Lasik is appropriate for you, you could join the many people who have benefited from this widely performed procedure. At Dulles Eye Associates, our mission is to utilize advanced technologies to promote your eye health and improve your lifestyle. If you have any questions after watching this video, I will be happy to discuss them with you.
My name is Brent Deal, and I am a director and a cameraman of television commercials. And I've been wearing contacts since 5th grade.
I'm Jerry Betromovitz. I am a certified financial planner, practitioner, and money manager. I've sailed the majority of my life, and one of the problems in sailing has been I'm often in the wind, and sometimes the wind would come underneath the contact lens to dislodge it or irritate or create dry eyes.
Well, my name is Mary Stevens. I'm a scientist by profession. In my other life, I spend as much time as I can in the outdoors, hiking and biking and camping and a lot of backpacking. I started wearing hard contact lenses when I was 14, and with hard lenses, they're, in my opinion, are really never very comfortable. And I switched to soft, extended wear lenses.
We worked some pretty long days. Towards the end of the day, my eyes would get pretty tired, and I wouldn't trust them as much as in the morning. They just would change over the day, and they would hurt. So I would actually have my assistant focus the camera for me, just to make sure that it was right.
Several years ago, I became aware of the Lasik procedure and started hearing more and more about it and about the success of some of my friends and colleagues that went through the procedure.
I was interested in this procedure, and I looked into it and thought it was right for me.
If you are considering Lasik, you're joining millions of people who have decided that they would like to reduce their dependence on glasses or contact lenses. You and your ophthalmologist will work together as a team so that you clearly understand how Lasik works and what you should expect from your surgery. In this video, we will see how Lasik has made a difference to so many people. But first, let's take a look at how the eye works.
Light rays enter the eye through the clear cornea, then through the pupil and the lens. These light rays are focused onto the retina, a light-sensitive tissue lining the back of the eye. Signals from the retina are sent through the optic nerve to the brain, where they are interpreted as the images we see. 70% of the eye's focusing power comes from the cornea. When people have problems seeing clearly, it is frequently because of a refractive error. Lasik is specifically used to treat myopia, nearsightedness, hyperopia, farsightedness, astigmatism. Myopia is also known as nearsightedness. This occurs when the distance between the cornea and the retina is too long. Light rays entering the eye are focused in front of the retina, causing the image that falls on the retina to be blurred. Hyperopia is also known as farsightedness and occurs when the distance between the cornea and retina is too short. Light rays entering the eye have not yet come into focus when they reach the retina, so again the image is blurred. Astigmatism is a condition in which the cornea is curved unevenly. A cornea that is curved the same in each direction is shaped like a basketball, while a cornea with astigmatism is more curved in one direction than the other, like a football. Light passing through this uneven cornea is not properly focused on the retina. People considering Lasik might have one or a combination of these conditions. For many years, glasses and contact lenses were the only way to correct these refractive errors. But today, Lasik is offering people an alternative that can reduce or eliminate their dependence on corrective lenses.
Lasik, or laser-assisted in situ keratomileusis, is an outpatient refractive procedure. It combines surgical and laser treatment to reshape your cornea. LASIK is used to treat certain types of nearsightedness, farsightedness, and astigmatism. It is the most common type of refractive surgery, accounting for more than 90% of all refractive procedures performed today. With LASIK, there is generally little discomfort during and after surgery, and you recover your vision quickly.
With LASIK, your ophthalmologist creates a small flap in the front portion of your cornea using an instrument called a microkeratome. Once the flap is lifted, laser energy is applied for a few seconds to a minute or so to reshape the cornea. Then the corneal flap is returned to its original position where it adheres naturally. After the procedure, the reshaped cornea focuses light more accurately on the retina.
I felt that I was extremely well informed going into my surgery, not only with what I could expect as an outcome, but with the procedure itself.
My wife dropped me off, and I went in, and they put the numbing drops in your eye, and then they march you into the big room.
I was told that it would be a fairly short procedure. I was in an inclined, relaxed position.
From what I understand, he puts something in your eye that keeps it open, and then he tells you to stare at this red light.
They had me look into a red light and to concentrate and focus on that, and then literally in under a minute's time, the procedure from the laser machine was completed.
I believe the LASIK procedure for me was 29 seconds.
And everybody had told me it was a very quick procedure. And quite honestly, you don't believe that until you look at this red light for 15 seconds. And he backs off and says he's done.
It was painless, completely painless, and came back out. They waited to make sure everything was settled back in place as it's supposed to be, checked me again in about an hour, put an eye shield on, and sent me home.
To be considered a good candidate for LASIK, you must have a stable eyeglass or contact lens prescription within a correctable range. You must be free of significant eye disease, and you should also understand the potential risks and side effects of LASIK. Side effects of LASIK can include dry eye, undercorrection or overcorrection, which may require retreatment, or poor night vision. Less common side effects may include inflammation, infection, or irregular astigmatism. Talk with your doctor about these and other more serious complications that may arise from having LASIK. While complications generally are rare, it's important to discuss them fully with your ophthalmologist. It's also important to discuss your expectations for vision after surgery.
I did not have any problems with side effects such as dryness. So I will say I was told to use some eye drop, fairly frequently. It was part of my post-op instructions, and perhaps that prevented any dryness.
I didn't have any glare or hazing at night while driving. I didn't experience dry eyes.
The only side effect I can see there are halos at night when I drive. If it's a dark environment and there are quite a few cars on the road, I see quite a bit of haloing. They got a little bit better and have now seemed to have leveled off, but I'm still 2 months into this. But if this is the biggest minus I have to deal with all of the pluses I get from this procedure, then that doesn't bother me.
Back to one.
Laser vision correction may greatly reduce your dependence on glasses or contact lenses, but you may not be able to discard your corrective lenses completely, particularly as you get older.
I elected to have some reading glasses made for me so that I would be more comfortable reading for longer periods of time.
But if you and your doctor decide LASIK is right for you, you may join millions of people who have had LASIK and are enjoying active lifestyles that are less dependent on glasses or contacts.
In terms of having the LASIK procedure, all I can say is that I highly recommend it. Everyone, in fact, I know that has had it done has raved about the procedure.
A couple of things I noticed right away were that colors were more vivid. I was almost overwhelmed by peripheral vision, noticing things out of the corner of my eye which I couldn't have seen out of my glasses or contact lenses. And so I had so much more information to deal with, which was very exciting.
The majority of people get to take seeing for granted. The majority of us don't have bad eyes. I did have bad eyes, and I don't take seeing for granted. All my life I'd wanted good sight, and I didn't have it, and I do now. And it changes you on so many levels.